COVID is a lonely and challenging disease. It is true that many people who get a COVID infection appear to have minor symptoms and do very well, but we still don't know who's who. Who's going to be part of that 80% where they have like a bad flu or feel like they have allergies, and who's going to end up in the hospital or very ill. But even those people in the 80% category who seem to have a fairly mild course, nobody knows what the long-term side effects or residual damage will be in your body. You may be 20 when you get it and feel like it was nothing, but you have no idea what it's going to have done to your body that may have an impact on you when you're 50. We just don't know these things yet.
You know, the science and experience these last several months has shown us that when you are fully vaccinated, the likelihood of severe illness, hospitalization, and death is extremely low. It's very protective. And that's what it's going to take for us to be able to feel safe around our neighbors and our family and our loved ones again. The quicker we can get vaccines in arms, the quicker our whole society will be back to normal.
And as we're facing down the possibility that a far more infectious, rapidly spreading strain of the COVID virus is on our soil and is spreading right now.
And if we can get these current vaccines in arms before that variant can take root, before new variants can develop, that's what's going to make the world safer again. I get a lot of questions about the vaccine. Is it going to make me feel bad? Bottom line is, am I going to regret this tomorrow? Am I going to regret having gotten this vaccine 3 months from now, 6 months from now, a year from now? Tens of millions of Americans and hundreds of millions citizens of the world have had this vaccine. The number of people that have had really life-threatening reactions to the vaccine has literally been 1 in a million. We've reached the point in this pandemic where so many of us know people who've died, people who've lost their life. And if we'd had this vaccine a year ago, there are a lot of our friends and our family that'd still be alive. And I think that's really the bottom line when it comes down to the risk of the vaccine versus the risk of not getting the vaccine. I think it's much more important to get the vaccine.